and welcome. I'm Sarah Flood. I'm the director of our Life Course Center here. I'm happy to kick off today's seminar. I have a couple of quick announcements. It's our last seminar of the semester. We'll be back in the fall with a fabulous lineup. So we're happy to have a wonderful speaker here today to end it. Since today's the last seminar, I want to take a quick opportunity to remind you all of the Data Intensive Research Conference that will be held this summer. It's co-hosted by LCC and IPUMS. The focus is on novel data linkages and innovative life course research. There's also an MPC poster session at the event. So this is for everyone. So please attend if you're around. Registration's open. The event is July 22nd and 23rd. If you have questions, check out lcc.umn.edu or talk to me or Amy or Kari, Jeanette. There are lots of folks you can ask. Lindsay. All right, so now I'm going to turn it over to Sierra Clark, who is going to introduce our speaker today. Sierra is a population health trainee and a doctoral student in sociology.
Today, I'm very happy to introduce Dr. Tamara Dubowitz, Chair and Professor of Epidemiology at University of Pittsburgh. Dr. Dubowitz is a social epidemiologist whose research focuses on the role of place and geography in shaping the health of marginalized and minoritized populations. Her work examines how neighborhood investments and policies such as housing, food systems, and urban planning impact outcomes like diet, food security, sleep, and cardiometabolic health. As a part of the workshop's tradition, I'm excited to present her with the esteemed mug that can only be received by presenting.
I have to make sure my mic is on. Amazing. I think I need to put on my reading glasses to actually see. Minnesota Demography and Aging Seminar Series. Oh, you don't have to ship it. Oh, really? Okay, can everyone hear me? Is this mic thing? All right. I was told to wear like something with a pocket or a I didn't. So I'm super excited to be here for your last seminar. This was the one that I requested because Teresa asked me if I would come and talk, and I said I would only come when it was warm. And she was like, well, you're going to have to come in May. So here I am. I'm really excited to present today on work that I've been involved with in Pittsburgh. So I am located in Pittsburgh. I'm at the University of Pittsburgh in the Department of Epidemiology, but I was at RAND for almost 18 years prior to being at Pitt. So I've been there for 2 years, but this work has all been going on in Pittsburgh. So just a little roadmap of what I'm going to present. I am going to talk about sort of how this research was first formed with really one of my biggest questions, which is, can we invest in neighborhoods in order to ultimately impact resident health? Give you a little bit of a history of the PHRESH study, Pittsburgh Hill Homewood Research on neighborhood change and health. Tell you what we found, tell you what today's sort of situation is, and then hopefully discuss with you where we can go from here. Okay, so a little bit of a history. Here we see a graph that shows, or a figure that shows basically rates of overweight, obesity, severe obesity in the United States for the past 50 years. And I don't think it's any surprise to a lot of people in this room, or maybe it is, that we've seen these really rapid increases or really steep increases in obesity, particularly in the past 30, 40 years. We know that these increases in obesity, and we know obesity rates in general, have pretty substantial disparities. So red is our non-Hispanic Black women. This just shows women, by the way. Blue is non-Hispanic white women, and our orange is Hispanic women. So disparities have remained pretty much constant. We also know, or many of you in the room probably know, about the deep history of structural racism. Even though we're not allowed to say it anymore in NIH grants, we know it exists, and we know it's very much shaped our neighborhoods across the United States. We also know that with racial segregation in the United States comes the segregation of many amenities, resources, access to resources, etc. So what I was super interested in, at least I still am really interested in this, 15 years ago, was access to food and access to nutritious food. And that is sort of how this project was born. So the original, so just so everyone knows, PHRESH used to be called Pittsburgh Hill Homewood Research on Eating, Shopping, and Health. That was the first ever study, but we kept the PHRESH acronym. This study started because in better days, this was back in 2010, we actually had a lot of political advocacy that was started by Michelle Obama to say, hey, food deserts are an issue that we really need to address. And part of what Michelle Obama was really interested in was addressing childhood obesity. And she was the one that really brought this term, food deserts, to sort of the fore of it being something that people actually recognized as an issue. So what is a food desert? If you don't know, food desert generally is a geographic area that, whether it be rural or urban, where it is difficult to access food. Through a whole bunch of sort of political movements or advocacy, Michelle Obama had a huge part in this. There was a policy that was formed at the national level. It still exists. So you can look up the Healthy Food Financing Initiative. This was a policy put forward by DHS, USDA, or DHHS, the US Treasury, and USDA. It was an investment of over $1 billion to say, we are going to incentivize people, retailers, food access basically into food deserts. This policy was an answer to a lot of things. It was not only formed because of health reasons, it was formed sort of the action and interest behind this was economic development as well. So there were a lot of different reasons why this policy ended up becoming a federal policy, but I was really interested in it from the health perspective. Could this be called an obesity policy? And at the time, even though it was seen as an obesity policy, and the reason it was seen is because we had a ton of cross-sectional data that showed that obesity rates were much higher in areas where we had food deserts. This was largely cross-sectional data. But I knew that we did not have any sort of causal inference data. We had nothing to show that if we eliminate food deserts, we could actually also address obesity. So we actually didn't know, does better access to full service supermarkets lead to a healthier diet? So that was my first R01 that I wrote in 2009 when I heard that the Hill District neighborhood in Pittsburgh was going to get a full service supermarket. And I made the argument that this was an amazing opportunity to really build on something that was happening regardless, that we can see whether putting a full service supermarket in a neighborhood would indeed address obesity. So our main outcomes as part of this grant It was to the National Cancer Institute, by the way, because National Cancer Institute is really interested in anything that in risk factors for cancer, which is diet, alcohol, sleep, physical activity, smoking. Yeah, that's one too. Okay. So our main outcomes were diet, food purchasing behaviors, weight and obesity, neighborhood satisfaction, perceived access to healthy food. So that was what we sort of wrote the grant and said, this is what we want to look at. Okay, how do we design the study? Well, this is a map of Pittsburgh. And this is the Hill District neighborhood, and this is what we decided was going to be our control neighborhood. So we went through all kinds of questioning. Should we have one particular control neighborhood? Should we have multiple census tracts throughout the city that matched exactly the census tracts in the Hill District? What we finally decided on was that these two neighborhoods were sociodemographically extremely similar, both racially isolated neighborhoods within the city of Pittsburgh, both of which were food deserts at the time. We knew that there was no plans to have any kind of supermarket built or opened in Homewood, and there was going to be in the Hill District. So any kind of changes we could attribute to the supermarket. That was the thought at the time. So the general timeline was the supermarket was supposed to be, the supermarket opened in 2013. We got our data in 2011, and then we did a follow-up among these same exact people in 2014. Very briefly, before I get to that, let me just show you the neighborhoods. So actually, this is thanks to data from yours truly here, but you could see that when we were recruiting, so this is from 2005 to 2009, these neighborhoods are really similar in terms of median income, percentage Black, unemployed, below poverty, etc. Okay, so what did we do? Well, we wanted to get a representative sample of households, a geographically representative sample of households from both of these neighborhoods. The way that we did that was we actually went door to door to enroll households that were chosen we got a complete list of addresses of both neighborhoods. We took a random sample, and then we gave these addresses to our data collectors to actually go door to door and ask households to enroll in the study. The first thing that we did, however, was opened a field office. We wanted to create a community presence this was in the Hill District, but we wanted to help create a community presence so that people would actually enroll in the study. Part of this was to also hire resident data collectors. So our field coordinator, who was in charge of all the resident data collectors, and she's still our field coordinator, actually grew up in the Hill District. And then all of our data collectors were either from the Hill District or from Homewood, and they had to all go through a training process in order to become a data collector. So we went door to door. We enrolled 900 households from the Hill District, 400 households from Homewood. This was done on purpose. We wanted an oversample in the Hill District to be able to look at households who were further away from the grocery store, closer to the grocery store, et cetera. So just a snapshot of some of the descriptives or what our population looked like. So unsurprisingly, representative of the neighborhood, almost entirely African-American, large number unmarried or single, very low household income. Over half were on supplemental nutrition assistance program, what used to be called food stamps, within the past year. 70% female. This was not representative of the neighborhood, but when we did our recruitment, we said we want to talk to the person who does food shopping for your household. So that's why it was predominantly female. Very high rate of obesity. So 3/4 of the participants either were categorized with overweight, class 1, class 2, class 3 obesity. Yeah, sorry, I forgot to say that if you do have a question, stop me. So thank you. So the total number of households was close to 1,400, actually 1,372, with data that we analyzed. So 1,400 households total, 900 from the Hill District and 400 from Homewood. I'm also going to say one really quick thing before I show you sort of the community presence that our study had in the neighborhood and continues to have. The way that we enrolled participants was going door to door at all different times of the day. But our sample was disproportionately older because older individuals, households, were more likely to be at home. So this just shows pictures of the community-based approach that our study and all of our studies have taken. And I think when we think about quasi-experimental design and natural experiments in general, we don't tend to think of community-based methodology. But I was pretty committed to both, and I didn't think that one could work without the other. So this has really been one of the pillars of what this series of studies has become, which also introduces a lot of questions, sort of how can you maintain a natural experiment and also have community involvement? You don't want to screw up the natural experiment. For example, when we were getting information on diet and food purchasing, we didn't want to introduce any additional bias through any kinds of means by interacting with our participants in any kinds of ways. But we do have newsletter that goes out to our participants. Our recruitment happened when we were first enrolling people. We put sort of ads in church bulletins saying, hey, you might see a PHRESH data collector. This is what we're doing, etc. So we collect all this data in 2011 from all of our participants. So the data that we collected was done with a household survey that was administered by our data collectors. We asked questions all about food shopping and how you get there and where you go and what you buy. We did dietary recalls, but we also asked a lot of questions about perceptions of one's neighborhood, safety, perceptions of crime, all kinds of questions. This household survey was an hour and a half long. So we have lots of data. Supermarket finally opened. There's a whole story behind this, but that would be too long to tell you. But it was not a smooth natural experiment. The original supermarket pulled out. There was a delay, etc. But it finally opened. All right. What did we find? So fast forward, we collect our data in 2014, and this was our paper that showed what we found. Well, we were actually really surprised that we found improvements in diet, in some aspects of diet. We found increased satisfaction with one's neighborhood as a place to live. We did not find any improvements in fruit and vegetable intake, whole grain intake, weight, or obesity. The big takeaway was that all of the changes that we observed, so we observed these changes, this was done through a difference in difference approach. So we looked at our residents in the Hill District compared to our residents in Homewood over time, same exact residents in both of the neighborhoods. And we found these differences in calories, sugar, empty calories. This is calories that you get from like processed packaged foods, satisfaction with the neighborhood. The only outcome that was related to whether participants used the supermarket was perceived access to healthy foods. So in other words, the supermarket opened, we found all of these changes that one would think have to do with use of a supermarket or increased access to food, healthy food. And it wasn't related to whether participants actually shopped at the supermarket. So at the time we were like, okay, this is very weird. What's happening? We have no idea. Can this be another opportunity? Of course, because we need to do more research. So one thing that we learned along the way, and in addition to what we learned from the supermarket, is that a neighborhood investment, like a supermarket, doesn't just open with nothing else happening. It's just not going to happen that way. And part of how we learned this and really got to understand like the full picture was because of our community involvement. It was because of our data collectors who were residents of the neighborhoods. It was because our field coordinator grew up in the Hill District and were able to tell us the stories behind all of this survey data that we had collected. And in fact, when we went and we collected data on actually, this is sort of a retrospective from between 2011 and 2018, you could see that in fact, even though our study was designed to really isolate just a full service supermarket, and one can say that that was the main thing that happened during 2011 and 2014, although there was another investment here, the Energy Innovation Center. So sorry, on the top are all investments that happened in the Hill District neighborhood. This was what we call our intervention neighborhood. On the bottom were investments that happened in Homewood. And you can see that, in fact, there are investments in both places, and there are a bunch of things that have happened over time. And nothing really is, you can't have a natural experiment that is a laboratory where nothing else is happening. So that was one of the realities that we had to sort of address, even though we thought our natural experiment design was so great, where we were recruiting these households that were totally like a random sampling of households, et cetera. This shows a little bit more of the cumulative investments that happened in both neighborhoods. You can see that the Hill District neighborhood has a much higher sort of cumulative rate of investments than Homewood. So still, our basic idea of a natural experiment could still hold, because we had one neighborhood that was experiencing very different development than another neighborhood. And this shows a picture of sort of the locations of the different investments, which we also thought mattered a lot, because we wanted to know whether people who lived closer to all of these different investments were differentially affected to the people who lived way further away, right? So what this turned into, with sort of thinking about all of these questions, and of course, this really shows a representation of things that happened between 2011 and 2026. But the short story is that this one study became 5 additional studies. So from the original R01 that we got just to look at the grocery store, we got 4 additional R01 grants plus an extension. So wait, 1, 2, okay, sorry. 5 additional R01 grants that allowed us to follow our same households, follow all of the different investments that were made, but also look at all different kinds of outcomes. So we've looked at physical activity, we've looked at sleep, we've looked at cardiometabolic outcomes, and we're currently looking at cognitive aging. And I'm going to talk a little bit about how that study is actually designed a little bit differently. I thought I would just show you a few results. This is just like capturing the general results. This really entails 15 years of research. So there's a whole lot to say. There's a whole lot that we've learned. And you can really just point into like what you're most interested in and then say, well, what have you learned in this particular area? Because of the amount of data that we've been able to collect. But one of the things we were super interested in from the original study on the grocery store and on dietary outcomes was whether these changes held. So if you remember, the first study was done between 2011 and 2014. But in 2018, we collected data to understand the trajectories in both neighborhoods. And in fact, what we saw was improvements in both neighborhoods, but the only outcome that remained significant was our perceived fruit and vegetable access. So the blue is our Hill District neighborhood, and the red is our Homewood neighborhood. And each of these bars show the changes between 2011 and 2018. So when you see like a negative change, food insecurity decreased. So this is a little bit backwards, but it means that food security got better. So food insecurity decreased in the Hill District. It also decreased in Homewood. Healthy eating actually improved in both neighborhoods. Added sugars decreased in both neighborhoods, et cetera. The only outcome that remained statistically significant was perceived fruit and vegetable access. And neighborhood satisfaction, we saw like a marginally significant difference in difference. So you can see it actually went down in Homewood between 2011 and 2018 and went up in the Hill District, but this was only marginally significant. Just a summary of what we have a question here? Sorry.
There's a significant difference between, if there's a significant difference between the two areas in who is staying,
Yeah,
and like what are like migration in and out,
yeah,
because one of this sort of upwards trajectory, I think, would probably be consistent with the story that like people are choosing to stay in a neighborhood over time, rather
yeah,
than like in some areas there's like a constant churn in of like you have people who start out poor, they earn a little bit more income, they suddenly move out, new people who are very poor
yeah,
move in, and so those neighborhoods sort of remain stagnant, and that would probably remain like those health indicators would also remain like
yeah.
stagnant as well.
Yeah, so that's a great question. Migration patterns within both of the neighborhoods, since the Hill District is getting all these developments, has its composition changed over time? So more, or have there been differences in the composition over time in both of the neighborhoods? So just a couple thoughts. One, the findings that I'm presenting show the exact same people over time. So I'm not looking at like snapshots of, I'm not looking at snapshots of like the Hill District now, the Hill District later, Homewood now, Homewood later. We're following the exact same people over time. So these changes are longitudinally measured in the same exact cohort. The question that you're asking about the migration patterns and how this might, we actually haven't. So the only people who we've followed migration patterns of and who we're like including data of is really the cohort. So we are following anyone who moved out of the neighborhood. We still follow so long as they're within the city of Pittsburgh. So we've been able to track them and their census data over time, but to the extent, so we look at census data, and to the extent that the composition of the neighborhoods have changed, which they have, that's how we've looked at those factors. And there are some differences in both neighborhoods. They're not so similar, they're not as similar today as they were in 2010. So that is, you are onto something. But have we like dug into that? No. Another question. Oh boy, 3 questions. All right. Oh. I don't care. I mean, I can race through the last slides and I can make the presentation available to people. Like yeah, ask your questions.
Yeah, hi. My question is kind of related to that question, but if the neighborhood compositions changed, could the increasing investments also reflect like gentrification, which might put pressure on the people living in the community in sort of negative ways as well?
Yes. Yeah, the answer is yes. These neighborhoods, so I think the first person said, you know, you obviously are like plugged into the neighborhood. So remember, these are small neighborhood. These are, one of the neighborhoods has 5 census tracts, another one has 6 census tracts. Like Pittsburgh is not a huge city. So I can tell you qualitatively that neither one of the neighborhoods has dramatically changed in terms of either the investments or the racial composition. They are still both considered disinvested, racially segregated, isolated neighborhoods where if you're a new person that's coming to live in the city of Pittsburgh, it's unlikely that you're going to live in one of these 2 neighborhoods if you're given a choice, because general access to amenities and general safety and general crime is just, they've basically stayed very similar. But yes, we can consider gentrification to have happened in especially some of the census tracts. And I'll show one result from that in this presentation.
Just a quick question. Could you briefly speak on the decision to designate Homewood as a counterfactual? Was it strictly that they were another food desert? Did they have similar demographic?
Both.
Okay.
So we went through all kinds of questions about whether Homewood should be, whether there was one place within the city of Pittsburgh that we could designate as a control neighborhood that was like far away enough from the Hill District that there wouldn't be spillover effects to the grocery store that opened in the Hill District. Would Homewood people come to it? The answer is no. So we went through all kinds of conversations using both data, but also talking to people, like residents of the neighborhoods. Yeah. Maybe we'll ask one more and then I'll keep on going.
What is the attrition rate for both neighborhoods, and
Yeah,
how many
great.
people moved out?
Yeah, great question. So in general, our attrition rate, I mentioned that our population to begin with was disproportionately older. So from every data collection, our attrition rate is about 20%. So we've gotten 80% of the cohort each time we've each time we've sort of collected data. So at this point, attrition rate is fairly high. We're talking, so our population to begin with was 1,400. We've refreshed the sample a few times. So we're working right now with a population or a cohort that's anywhere from like 600 to 1,000, depending on what outcome we're looking at and how many time points we're looking at, et cetera. Okay, just to give like a summary of what we found of all these different outcomes that we've looked at in terms of, but honestly, you can say anything that you're interested in, and chances are, whether it's a health outcome or not a health outcome, chances are we've looked at it. So we found positive outcomes for sleep. We found mixed for physical activity. We found pretty much not too much with BMI. Cardiometabolic, we found improved things, and we found a lot of mixed results. And I'm going to go into a few of these in the next few slides, but one of the hard parts about this study is it's been really hard to summarize good versus bad, because it's depended on the outcome and it's depended on how we've looked at things. I do want to highlight like one thing I'm just going to highlight a few of our outcomes. So these are two cool figures that we published a few years back, actually a long time now, 2021. Geez, okay. That shows sleep. And we looked at this in two different ways. The red and the blue are actually the Hill District neighborhood and Homewood neighborhood. And then we looked at it in terms of whether you live close to an investment or far away from an investment, no matter what neighborhood you lived in, right? So this is just like two different ways of looking at things. We can divide it by Hill or Homewood, and we can divide it by living close to an investment or further away from an investment. Sleep duration, efficiency, this is wake after sleep onset, and sleep quality. These are all measures of sleep. So very generally, what we found here is our sleep quality is probably our most striking change. That sleep quality, not near an investment, we saw improvements in sleep quality. If we looked at it in both sort of neighborhood or in terms of close or further away from an investment, it got worse in both neighborhoods, but it got worser in Homewood. All right. Here is what we found when we looked at whether this was sustained over time. So the answer is at the title, some but not all sleep benefits were sustained over time. So you can see here, this is just looking at not near an investment and near an investment, and this is a longer period of time that here the sleep quality, we actually, found sort of not anything major, but our sleep duration got worse in both neighborhoods, but less worse when you were near an investment. Okay. Sleep efficient. All right, I'm going to skip over. Oh, this is just, all right, sorry. I'm going to go to the next slide. So this was work that was done by a doctoral student in public policy at Rand, who was really interested in looking at gentrification. So she divided the neighborhoods in terms of the actual census tract and defined whether gentrification happened over time within each of the census tracts, and looked at social cohesion and neighborhood satisfaction. And in fact, the question about gentrification is absolutely true here. That we can see that in gentrified or partially gentrified neighborhoods, we saw increases in social cohesion in both neighborhoods, but actually less of a slope in our gentrifying neighborhoods, right? So in our not gentrified neighborhoods, this actually was on a better trajectory. So this like goes opposite to living near an investment, etc. Okay, 5 minutes. Just a little bit about what we're doing right now. What we did with the study that is happening right now is that we said we have an aging population. We want to look at cognitive outcomes, but what we decided to do was to not look at neighborhood changes, but to rather look at our population in terms of their residential history and in terms of their educational history. So we're looking at this from much more of a life course approach. And one of the big things that we're really looking at is the trajectories of our population. This is just the design, which I'm not going to go into because there's really not enough time, but we're doing both qualitative and quantitative work in this study. Okay, so what's next? You can see that we've done a lot of work over the past 15 years. We've looked at all kinds of different neighborhood changes. Now we're looking at a study where we're looking at life course trajectories, same cohort. So right now in the Hill District, I talked about this with Andy already, but there is a massive amount of housing development that is being done. In fact, more than anything else, so this $50 million is really not a big deal. This is like $400 million worth of investment is happening right now in the Hill District where they are doing housing development. So this is part of a public housing project that is one of the oldest public housing projects in Pennsylvania. This is like demolition of areas around it. These are actually being built right now. This happened actually, like the URA, Urban Redevelopment Authority. Okay, I'll have to look up exactly what URA stands for, but there was just a vote that happened like this week or last week, that there's a lot of stuff happening in the Hill around housing. So the big question that I have right now is like, this is the biggest investment that's actually occurred in the past 15 years. Do we jump on this as a natural experiment or not? We have a cohort. We have lots of longitudinal data. We have a lot of data on both of these neighborhoods. However, our cohort is really sick of being part of observational studies. They've told us that. They want an intervention study. They're like, it's enough already. I'm like, I don't do interventions. And I'm not the one, I don't want to devise an intervention and I don't want to lead an intervention. I'm not a resident of either one of these neighborhoods. So in addition to the funding climate right now, being sort of like at an inflection point, what do we do next? I'm really asking myself and everyone else, including everyone here, do we continue as a natural experiment and sort of jump on this next opportunity? And who knows if the timing will work out? Or do we move towards a co-designed intervention? This is really what our cohort wants to see. Or do we do both? How do I do that? There are all kinds of scientific, ethical, practical tensions involved with all of these decisions. There's scientific questions, there's quasi-experimental validity, there's the single outcome, but I'm really interested in whole of systems approaches, generalizability. There's all kinds of questions that we're asking ourselves right now that I've heard some of you ask during the talk. So these are the questions that we're currently asking. If people here have the answers, I definitely want to hear them, or potential solutions. But I'm going to kind of wrap things up by just saying what all of this work has, some of the things that we've learned, some of the most important things that when I reflect, this is what we've learned. So I'm still a big believer that all research and all research questions need to have both conceptual grounding based on theory, but also lived experience. So I think one of the ways that we've been able to really capitalize on our situation is by informing a lot of our research questions on the lived experience of the people, not only our participants, but especially our research staff who have helped inform where the directions should be going. This is community engaged work. And I had some questions and conversations with people like, how does this happen? I started really, really, really early on when I first had this question of like, is a supermarket, what's going on with the supermarket? Is it going to change things? By starting to talk to people, starting to talk to just residents, like people who are the I don't know, more active people within the neighborhood, stakeholders, event community organizations. One of the huge challenges that our work has had in general is being able to publish in both like scientific peer-reviewed journals, but also making sure that, that both matter. Okay, I didn't see the 1 minute warning. You forgot it. All right, fine. I'll wrap up. Policy implications from research matters. And we do need more work that combines multiple policies, multiple outcomes, more systems work. I love this. This is like a cartoon that you may have seen before, but this really shows it really depends on where you're sitting in terms of what you're seeing. It's a spear, it's a snake, it's a wall. Like, no, it's like back up a little bit. It's all of this. Every system is perfectly designed to get the results it gets. A bad system will beat a good person every time. But this is really the quote that I would say has, primary determinants of disease are mainly economic and social, and therefore its remedies must also be economic and social. And Jeffrey Rose said that, not me. I want to thank our team. So these are our data collectors and our field coordinator, who all are from one of the two neighborhoods. This has been funded by primarily by NIH, but collaboration between community partners. And our team is very large. We span RAND, HIT, community organizations, and institutions really across the country, Arizona State and UCSF. And we have lots of pre-docs, postdocs, students, etc. Come join us. Thank you. Okay. Now I think we're allowed to ask questions.
I got sort of two questions which are related at a pretty abstract level. First is, could you say a little bit more about what you meant by gentrification? I didn't hear a sort of an operationalization of that.
Yep.
And secondly, when does something sort of stop being a natural experiment because it's so long since the thing happened, and when does it just become observational?
Your first question is way easier than the second question. Okay, operationalization. Okay, operationalization. Okay, so gentrification. So again, this was done by doctoral student, and now it's been a few years. So I might need some help from our audience members. We looked at the composition of each of the tracks over time, and I believe it was education, median household income, and then value of the, there were three things that were used to actually operationalize the measure. And I'd actually have to go to our paper to like look at the methods, but it wasn't just like, oh, this looks different. It was a true method. Yeah, but it was actually Lance Freeman it was his measure that we used. but I'm not able to think on my feet right now. It was definitely education level, median household income, and then there was a third variable that we also looked at, just in terms of composition and compositional change within the census tracts. When does this become observational? So that just depends. If you want to sell a grant, never. Like, everything is a natural experiment. And that is how we've gotten 6 grants funded. There are different levels to the sort of, I don't want to say the integrity of the natural experiment, but like how pure it is. And I think that has been definitely a challenge, but the answer is to acknowledge, to like just collect more data so we can really try and overcome the limitations that we know are there. So really, I think that we should be looking at everything as a natural experiment. I don't know. What do you call that? When someone is a something, everything, when someone is a whatever, everything, hammer, nail. I don't know. Yeah. Oh, you're not being called on. Okay.
Oh, I just had a quick question. You've had so much funding, but it didn't look like all that much was significant. So how do you keep that going?
Oh, sorry, I didn't show, like, we have a lot of things that are significant. It just depends on the outcome. I guess I showed, so it was our big funded studies, really, like, the supermarket mattered for a lot of things in ways that were different. The green space, we did a green space study. Didn't change any of the outcomes that we were interested in, but that was important, right? So I guess in direct response, I'd say our non-significant findings are as important as our significant findings, but to me, it's also a question of, are we measuring the most appropriate thing? And for the grantsmanship and what we're asking for from the NIH is not always what matches what the residents think are the most important outcomes, right? So there's a difference in that as well. Okay.
Thanks for a great talk. It was really interesting. And this kind of builds on Claire's question. So I guess my interpretation of what you're finding with respect to how the grocery store didn't really change the outcomes you were expecting it to is that it's less about where you live and more about kind of the broader information that we're all swimming in regarding food. So, I mean, you can go into a grocery store and you can buy an apple, but you can also buy a Twinkie or a Pop-Tart.
Yeah.
So do you think one of the implications of your finding is that it's less about a food desert and it's more about the whole food system and the whole, advertising these convenient, yet less healthy foods?
Yeah. So for the food in general, our hypotheses, so we did a bunch of papers just to show what the grocery store did in terms of changing the healthy food environment and the unhealthy food environment. So if you walk into a grocery store, you have much more access to unhealthy food than you do to healthy food. Like, the unhealthy food actually became much more accessible than the healthy food. So our hypothesis was that this is not going to do anything at all in terms of healthy, like, despite we wanted to address obesity, we want supermarkets to, like, residents really wanted the supermarket. But our hypothesis was that diet was not going to change. And then when diet did change, we were like, what? Like, this makes no sense. So I really, truly think that this is part of diet is part of a much larger system. So there was obvious investment that happened in the neighborhood. people were in so many ways, like they were thinking about their increased access to food. Like there were a lot of things that happened that I think ended up improving diet, certain components of diet. And I really truly think it's part of like the overall investments that have happened in the neighborhood and the sort of surge of both retail and the sort of landscape differences that have happened in the neighborhood. But yes, the supermarket actually created opportunity for more unhealthy foods than it did healthy. Yeah.
Hi, I'm Deborah Levison. I wanted to circle back to your really big picture question that's so important. What do you do next? And I wonder, what do the residents want? What do the people that you've been talking to over all these years, what do they say they want as interventions? And is it remotely fundable? I mean, those seem to be interconnected, right? You can't do it unless it's fundable.
Well, that's
but you
my
can't
problem.
continue because they don't want to continue with you unless it's what they want. So I don't, and I think somebody, do you have a follow-up to that?
No.
I think that a lot of what we've learned is that like one intervention that focuses on one thing is just we need like something that increases social cohesion, social support, and diet and physical activity, and like a multi-systems, multi-sector intervention, right? Is it fundable right now? Totally not. I mean, maybe, but that's part of the issue. I don't know. Maybe it's fundable. Maybe I'm just being like, I don't know. Maybe I'm tired and I don't think it's fundable. That's what our residents want. They're like, don't tell me what I already know. So a lot of our findings, although they provide evidence and systematic documentation to impact policy decisions, if people like, I think a lot of residents would say I could have told you that 15 years ago.
I was happy to see the slides where you compared two different ways of measuring the effects based on just membership in the neighborhood versus distance from the investment.
Yeah.
However, on the map of investments, it looked like your investment sample were just the things that were in the neighborhood. Did you also consider investments just outside the neighborhood?
That's a great question. So for our current analyses, not so much. Would love to do more of that work.
Are you aware of investments that could have been impactful?
Yeah, for sure. And so the only way that really has been collected is really our first study, which was then a continuation, which when we said, oh, where do you do your food shopping? And then when people said where they went food shopping, we actually went into those places and we audited them no matter where they were. So there were a lot of Aldis within this time period that actually opened between, like, closer to our control neighborhood. A Target that opened closer to our control neighborhood. So that became a place that we actually audited that was included. So if people reported on it, it was included in depending on what our analysis was. So in answer to your question, we could do much better at that. And we haven't done like full analyses of that, but it's not that hard to get that data.
My question would require you to be a bit speculative, so you don't have to answer if you don't want to do that. But it's about, would you expect anything to be different if instead of a supermarket, it was a co-op with, say, like a community garden, where there's like shared kind of, ownership of something?
Great question. much more of a discussion, yes, I would expect it to be different. Absolutely. Because shared ownership and shared commitment to the investment is better. Yeah.
I was wondering about activity spaces, right? So we've talked a lot about food shopping, but that's not all people do during the day, right? Have you thought about doing some kind of EMA or activity space analysis to get a sense of like what's the cohort experiencing on a daily, weekly, monthly basis?
So great question. We collected a lot of that data, not from like cell phones. Our population is older, and I think more people have gotten smartphones now, but the whole 15 years, not everyone had smartphones. But in our activity study, so people wore accelerometers, so we saw like their actual levels of activity, but we didn't see like where they went. But we asked them to report to us, so it was all self-report on a daily basis for a week. Where did you go? So we do have that data, but we actually haven't. We've done like some not like an EMA analysis, but we've done analyses to show that people's circles are actually small. Yeah.
All right, we're out of time. Let's thank our speaker once more.
Thank you.